Welcome to Dental Campus. This is a module on the how-tos of 3D radiology. And the present lesson focuses on how to use CBCT in implant dentistry. Our present learning objectives are: how does CBCT work? What is the difference between multi-slice CT and cone beam CT? And in the third place, which variables influence image quality in cone beam CT? Now, CBCT has become very popular in dentistry. One can question why. One of the reasons why it's popular in implant surgery is because it offers a 3D. It offers also a low-dose image data set. Although nowadays with CT you can also obtain a lower dose. It offers details even up till a level of below 100 micrometers. It offers the possibility of viewing and reformatting the images and also integrated in a pre-surgical planning system. And furthermore, it has a lower cost than CT, a smaller size, and is also easy to use. Cone beam CT has not been developed by dentistry. It was already used in radiotherapy, where it's used at both the level of the radiotherapy planning and the level of the therapy itself by using megavoltage cone beam CT. It is also popular to use it in cardiac imaging for proper visualization of the heart. Furthermore, cone beam CT is also very popular in the perioperative setting, as it can freely move around the patient's head. Furthermore, it is also popular in the orthopedic or the emergency setting for fracture imaging. And another field where it has become increasingly important is the field of veterinary surgery, as it offers 3D images at a low dose and in a compact size, low-cost machine. When Röntgen developed the X-ray tube, he probably did not realize that for more than 100 years the same X-ray tube would be used in dentistry. Indeed, in our intraoral X-ray machines of today, a similar principle envelope is still used. Only with the introduction of cone beam CT, this anode composition became more complex. Nowadays, there is a variety of cone beam CT machines on the market, going from panoramic machines to proper cone beam CT machines, and in total there are more than 60 different machines available. Some of these machines, as stated before, are basic panoramic machines with a 3D option, but still they have an integrated cone beam. Secondly is the group of the hybrid machines, where you have the cone beam next to a panoramic machine. And a third and most expensive option is to buy dedicated cone beam CT machines who can only take 3D image scans. There's also an important distinction between, on the one hand, cone beam CT and on the other hand, the multi-slice CT. A cone beam CT is actually a machine where you have a conically shaped beam rotating around the patient's head in one movement. The circular movement can be a full or half or partial circle. With the multi-slice CT machines, the patient is actually placed on a bed that is moving through a cylinder where on the one hand you have the X-ray tube and on the other hand you have the detector arrays. And thus you have to compose your image in the multi-slice CT with various layers scanned one after the other. Yet nowadays, when you compare a single slice CT scanner with a multi-slice CT scanner, you will notice that while in the past one rotation meant one single slice of the patient head, a multi-slice scanner like the present one showing 4 slices next to each other can scan thus much more information at the same moment. And current machines have possibilities for 64 or even more slices scanned in one movement, thus increasing the speed of the machine, increasing the resolution, and at the same time also lowering the dose. This is shown here. The present multi-slice CT scanners offers an image resolution very comparable to those of cone beam CT. Here you see actually the ossicles in the ear perfectly visualized in the CT machine at a lower radiation dose and a fast speed. Here you see coronal images captured from the same head and registered at the same place, with on the one hand a very fast multi-slice machine and on the other hand a new cone beam machine, and you will see that data are very similar when it comes to resolution but also radiation dose. Other variables which may influence dose and image quality in the cone beam CT are listed: voxel, the position of the patient, also the field of view, the fact whether the radiation is pulsed or continuous, the movement of the patient, the use of metals in the mouth, the kind of detector used in the cone beam CT, the parameter settings like the milliamperage, the seconds and the kilovoltage, and also, not to be underestimated, the reconstruction protocol. Now, a cone beam CT image is composed of voxels, and voxels are volume elements. And a lot of voxels compose a cylinder from your 3D image dataset. One can easily understand that if you have more and smaller voxels, you have actually a better resolution and you can better approach the reality. This is shown for an image of the brain here, the 3D model with larger and less voxels, and the same for a teapot. The 3D image dataset allows you to go for multiplanary formatting, normally in 3 orthogonal planes. And we call them normally the coronal, sagittal, and axial plane. This is explained in the following slide, where you see the cylinder of the scanning. The axial plane is actually the horizontal scanning plane, thus yielding information on the horizontal level of upper and lower jaw. Then you have actually the coronal plane, yielding information on the symmetry between left and right side. And you have the sagittal plane making a cross-section through the skull as visualized by this line here and as seen here. Another very important point is the field of view. The field of view is very important because it relates to the radiation dose. The bigger the field of view, the larger the radiation dose. At the other hand, it also means that the larger the volume, the more information to be observed and diagnosed. So the field of view will be also related to the indication. And once you obtain a field of view, it should be maximally diagnosed. The smaller the field of view, the smaller the voxels can be, and thus the higher the resolution. Bigger field of views are sometimes useful to get an overview or even an exclusion diagnosis when it is not clear where the origin of the pain from a patient is coming from. Another factor to be considered is whether the radiation is pulsed or continuous. In this example, you see that with pulsed radiation, you can also obtain a 3D image, Because the radiation is not continuous, the radiation dose to the patient will be smaller, yet movement artifact will be similar as the normal rotation time will remain the same. Continuous radiation will probably yield better resolution, but also a higher dose level. Another important point to consider, and published by Pauwels et al. In 2013, is the fact that the reconstruction algorithm and the influence of metal is very much variable amongst machine and amongst parameter settings. Here you see the testing of one and the same cylinder with metal rods in various machines and also with various settings. And you see that the performance at exactly the same level as it is registered in this image is really variable amongst machines, but also within the same machine with different protocols. This is crucial information as we often deal with the restorative work, the diagnosis of a post or an endodontic filling, and also the diagnosis of implants in the jawbone. Let me look with some cases at some typical examples. What is important? What is important is not only the machine and the protocol, yet also the content of the metal. Here you see, for example, a machine that has a reconstruction algorithm that is quite robust against metal artifact, but at the same time, this wire that is used with the brackets also doesn't have a high metallic density, as such not giving too much scatter. In this example, this typical patient has a good cortical bone and a good trabecular density, and this allows actually a good visualization of this implant without too many artifacts. This is also caused, and once more, because the cone beam that is used here has a good reconstruction algorithm avoiding metal artifacts. But when we come to these two images, you see that they are from the same right upper jaw with metal in the teeth in both cases, and yet a completely different performance. There's no artifact around this implant, and there's no artifact around those fillings in the molars. Yet if we take this patient, we see a lot of artifacts and therefore also a detrimental effect on the diagnostic image quality. How is this possible, such a difference? We therefore performed a study based on a CBCT simulator based by the development of Sang, and he first developed an artificial jaw model which was then scanned by the CBCT simulator, yielding these images. When comparing them to images where in this jaw metal was placed, you see the artifact of the metal. Subsequently, he also applied movement to this artificial jaw, and you see a detrimental effect of movement, but the effect that has most consequences is a combination of metal and movement together, with an effect that is more detrimental than both individual artifacts. So it should be avoided to scan a patient that can't sit still with restorative work on implants in the jawbone. Finally, and importantly, this image coming from a publication by Liang et al. In the European Journal of Radiology in 2010, you see that when registering one and the same area in the jawbone with different cone beam CTs, you obtain a very different output with the cone beam CT machines available on the market. If, for example, you focus on the mandibular canal, you will see a variable expression between all the numbered cone beam CTs for this specific and vital neurovascular structure. The conclusions of this lesson are as follows. CBCT data are acquired by a single rotation in a conical shaped beam around the patient's head. As multi-slice CT nowadays has a higher number of slices made in one rotation, you can actually become a better speed, a decreasing radiation dose, and a better spatial resolution of your images. And last, there are many variables influencing CBCT image data, and those variables are related to the machine, to the software, to the exposure parameters, as well to individual patient factors. I thank you for your attention.